Now let's move to the second aspect, and the second aspect is how will these cities tackle the cases? And Mr. Javed Ansari, let's talk about the problematic cities, whether it's Mumbai still because of the large number of cases that we're reporting still every day, and Delhi, which is now beginning to see that kind of 800, 900,000 cases every day. They have failed to build up their health infrastructure. Now, will that become challenge number one? And until we do that, should we again go into the lockdown? What are the authorities now thinking of doing?
Look, the authorities are none the wiser. They are groping in the dark, and so is the public. You can't, at the time of war, you can't build up infrastructure. So the infrastructure is virtually non-existent. It's abysmal. They ought to learn from Kerala. They ought to learn from the other cities, from Ahmedabad, from cities that have turned it around. Do things on a war footing. I am told that the worst is yet to come. The worst is ahead of us, that this will continue to spike and peak either by the end of June or in the first half of July. And it's only towards the end of July that we will see some kind of, downward trend. Well, till then, you just survive in hope and in prayer, on a hope and a prayer, because there is very little. There are not enough beds. There's virtually no testing happening. 2,000 testing 2,000 people for a population of over 1 million amounts to absolutely nothing. They need to ensure that there are more beds, build quarantine centers. There are vast sporting stadiums here which are lying vacant. Use those. Use hospital. There's a mammoth hospital here, the All India Medical Institute. Why can't that just be converted into a COVID hospital? Let people be quarantined there. Let people be quarantined in these 5-star hotels which have been shut. And for God's sake, please shut down places of worship. We can all pray from our homes. I'm a believer. I pray 5 times a day. I'm very happy doing it from my home. Don't open all these places up. Don't open malls. These are things, this is not essential. We can do without these things. So as a resident of Delhi, I shudder to think what lies ahead of us. Tomorrow, if God forbid, I contract this, I won't know where to go. Even somebody like me who's a journalist, and I know few people in this town, I won't know where to go. There are, unless, we've just been left. It's all Bhagwan Bharose. I'm sorry to sound alarmist. I'm not one amongst those, but the situation is such that, you ask anybody, you hold a poll in Delhi, and 99% people will say that we've all been left to the mercy of the gods.
Yes, absolutely. And, it's not being sounding alarmist, Mr. Javed Ansari, because what you're saying is simply the facts. The government itself sounded as alarmist as it could be yesterday when they came out and said, well, we are anticipating 2.5 lakh cases by, July, and end of July, it could be 5.5 lakh cases, which means we need 80,000 beds. Let's get the stadiums going now. Let's get the hotels going. Suddenly, this conversation that is now happening in Delhi, the same government, Vinay, 15 days ago was telling us their health infrastructure is ready. Arvind Kejriwal in the beginning of May was the first one to come out and say we cannot be in lockdown forever. Our health infrastructure is ready. The cases will go up when you lift the lockdown, but we are prepared. Let's go. Let's open our shops. Let's restart our economy. Now it seems like as if the health infrastructure is not ready.
Yes, and I think now that we've seen about 3 months of this war against corona, there is one very clear pattern. There are chief ministers and there are people who govern our states who have believed that lockdown was the solution. There are some who were probably smarter who realized that lockdown was an enabler. That's not the solution. And I think if you just think that lockdown is the solution, then this is what happens, because that's not what the lockdown was meant for. The lockdown was meant for you to enable you to prepare for an eventuality where the cases will rise. And in Delhi, I sense that there is a bit of a smugness that they had, that our infrastructure is the best and we are the greatest and we have the best facilities in the country, and hence we'll be able to handle it. I think this was a little bit of an ignorance about understanding how this virus works. There was a little bit of an ignorance about understanding the nature of the city of Delhi and the requirement that would have exponentially grown. It doesn't help if you stand on 10th June and say that contact tracing is impossible. Of course it is impossible, because now the number of infected cases, the likely number of infected cases is just way too high. That's where I like the idea of that Bangalore pursued, because that's the example of how they used the lockdown not to think that this was a solution, but used as an enabler and went very hard at contact tracing right at the start when the numbers were fewer, and ensured that the spread did not happen. And that's where Delhi seems to have lost the battle. And now we will only play catch up. I mean, this is not something that they could have prevented it, because Delhi does have superior health infrastructure compared to other cities. Javed is absolutely right. You have AIIMS, you have Sadarjung, you have very large hospitals and stadiums and various other places which could have been contained, converted into containment zones or isolation wards. Nothing of that has happened till now. It's only now that they're beginning. Tanvi.
In fact, just very quickly on that, back to Mr. Javed Ansari. Mr. Ansari, I know what you're saying is absolutely right, but do you fear that won't happen because of also politics? Because when it comes to the national capital, everything boils down to the center versus state. And the center in this case obviously hasn't decided to open up AIIMS hospital for more COVID patients. It's such a huge hospital, but I believe only about 250 to 300 of those beds are actually dedicated for COVID patients. And likewise in many other hospitals, it's something that the center should be immediately looking at.
COVID, Tanvi, if either Mr. Kejriwal or those who govern at the center believe that the fault will lie only with their opponents and not with them, they are mistaken. This will sting them in a manner they cannot fathom. Everybody's sitting pretty at the moment, but you talk to people on the streets, and you sense their sense of fear, their anger, and their total helplessness, and this is going to manifest. I do believe that at some stage, because Delhi happens to be the capital of India, and therefore they can't allow it to run aground, the center and the state will get their act together. But when will they do that, and how much of a toll by then will COVID have extracted in terms of lives of the people in Delhi is anybody's guess. But the fact is that at the moment, they haven't even begun it, and they ought to have done it day before yesterday. The signs were there. This was a pandemic foretold. This was a disaster foretold. Yet they were both sniping, trying to score political points. When I was absolutely right. In the beginning, they were both trying to score political points. Mr. Kejriwal assured us that he's made arrangements for 4 times number of than what is required. And what you realize now is that that not even half of that is true. The center is sitting pretty, very happy that allowing Mr. Kejriwal to stew in his own juice. But the fact is that if this spills over and if this blows up, it would spare no one. Even the center, even those sitting pretty at the center will have to take a lot of the blame.